YouTube family, I am back and I'm actually on a more somber, I'm here on a more somber tone. And the reason why is because I am going to tell you, I'm just going to get a little bit personal tonight. Well, yeah, it's 6:50 in the evening. And I am going to let you in a little bit on my personal life, so yay. Okay, so what's going on with me? I'm having some health issues, and the issue that I have going on, first of all, I know that it's a lot of women that basically is embarrassed to talk about this, and to be honest, I was embarrassed too, but then I thought maybe somebody needs to hear about this. Somebody is experiencing these things and they don't know how to talk about it to anybody, so they need somebody to just, I guess, to listen to, look at, or when not on YouTube, and just gain their insight that way. But what I'm going to tell you is about what's going on with me. Now, I'm just going to give you a little timeline of what happened. So, what happened was it was on, not July, because this is July now, but June the 29th. Now, keep in mind, if you know me, you know my birthday was actually on June the 9th. And so 20 days after my birthday, I started to have these symptoms. And the symptoms were actually pain in my lower belly area, my lower abdominal area, middle abdominal area. I know I'm probably saying it wrong. Abdominal. Yeah, abdominal. Okay, so I had pain there. I had pain in the back of in my lower back. It was so painful, 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 painful. I think I went through pain for at least 3 to 4 hours before I decided to go to the doctor. And this was late at night, so I ended up going to the doctor around 2. Yeah, I ended up going to the doctor around 2. And I stayed at the doctor at the emergency room. That's what I mean, emergency room. And I stayed there. I didn't get seen until like 2:45 ish, almost 3. And I just stayed there all the way until like 6 that morning, which was on the 29th, July 29th. So that night before was actually June the 28th. And that's when the symptoms started or whatnot. So on the 29th, I was at the doctor and we had to do CT scans and all of that. And what was found was that I have an ovarian cyst. Now, if you're unfamiliar with an ovarian cyst, I have some paperwork I'm going to just read off that I got from my doctor, which is very helpful for me. So basically, no, ovarian cyst is a fluid-filled sac. So fluid is in water, coke is fluid. It's not good for you. So those are some examples. One good one, one bad one. So an ovarian cyst is basically fluid-filled sac, and it forms on the ovary. So in my case, mine was is because I haven't had my surgery yet on my right ovary. Now, if you don't know what an ovary is, I'll be glad to get you that information too. Okay, so an ovary is basically you have two of them when you're female. Well, in most cases, unless you have a special circumstance to where you don't have two. But the ovaries are small organs that produce eggs in women. Now, women, let's see, how do I put it? You know, we have a menstrual cycle every month, or that's how it's supposed to be said. So basically, a release of the egg is going to be your menstrual cycle. So we're going to talk about the cysts a little bit more. There are various types of cysts that can form on the ovaries, and most are not cancers. Now, what scared me is basically when I heard cysts, I always just jump to, wow, is it cancer? And I know I shouldn't think like that, but I'm just an overactive thinker at times. And I was nervous and I was scared. So I'm out here thinking, is this cancer or something? And we're just really hoping it's not, because the procedure that I have to go through is actually a diagnostic laparoscopy. I don't know if I said it right. Laparoscopy. Yeah, that's what I'm gonna call it. But yeah, so I had to have it tomorrow. So we're gonna fast forward a little bit. Now, keep in mind the symptoms started on June the 28th. Now I haven't really had many more symptoms. Just probably a little dull bellyache here or there. So, and actually, after I found out my diagnosis, about me actually having the cyst, I actually started to take notice of my body a little bit more. And I noticed that every time I would go to the restroom, I noticed probably TMI, but I want to help somebody. So, I noticed every time I went to the restroom, that when I would urinate, I actually felt a little pull on my right side, and I took notice of it once I found out that I had the ovarian cyst on my right ovary. So I have that going on, and I have to go into surgery tomorrow. So what I'm gonna actually do is I'm gonna show you some of the things, talk about some of the precautions and all of what I have to take in order to prep for the surgery tomorrow. Now it is currently 6:56 now in the afternoon, evening, whatever you like to call it. So I'm gonna just tell you a little bit of what I actually have to do in a little bit later in the video. I'm just gonna talk a little bit, just give you a little bit more information about ovarian cysts. Now, the first kind that's on my paper is the functional cysts, and these basically occur every month during your menstrual cycle, and they're normal, which means that most women are going to get them. And these cysts usually go away with the next menstrual cycle if the woman does not get pregnant. Usually there are no menstrual cycles. Wait. I don't have my glasses on. Okay, so usually there are no symptoms with a functional cyst. And then the next one is endometrioma cysts. I think I said that word right. It's a big word. Okay, so these cysts actually form from the tissue that lines the uterus. Now, your uterus is where you have your baby to form once you get pregnant. Yeah, your own uterus. Yeah. Okay. Now, these endometrioma cysts were also called chocolate cysts. And that is because they're basically filled up with blood and it turns brown. Okay, and this type of cyst can cause pain in the lower abdomen during intercourse and with your menstrual period. The next one we have is cystadenoma. Cystadenoma. I spelled a word in the video, so you'll see what I'm talking about. I probably just butchered that word, but yeah. So this type develops from the cells on the outside of the ovary. These cysts can get very big and cause lower abdominal pain and pain with intercourse. This type of cyst can twist on itself, cut off its blood supply, and cause severe pain. It can also easily rupture and cause a lot of pain. And the next one is dermoid cysts. This type of cyst is sometimes found in both ovaries, not just one, but both of your ovaries. These cysts may contain different kinds of body tissue, such as skin, teeth, hair, or cartilage. They usually do not cause symptoms unless they get very big. And the last type I'm going to talk about is the Theca lutein cyst. Getting tongue twisted. These cysts occur when there's too much of a certain hormone. And an example of hormone would be human chorionic, Gonadotropin. I know I probably just butchered the mess out that word, but I'm going to spell it. Okay, and basically these cysts occur when this certain hormone is actually known as HCG, which is what home pregnancy tests monitor. So when there's too much of that hormone, then it overstimulates ovaries to produce an egg. This is most common after procedures used to assist with the conception of a baby or in vitro fertilization. And if anybody watch The show I watch a lot is Basketball Wives. And if you've heard of Evelyn talking about IVF, that's the same thing as in vitro fertilization. So those are the different cysts unless you're listed. Okay. So some of the causes of cysts are fertility drugs, and these actually cause multiple large cysts that can be formed in the ovaries. And this is called ovarian hyperstimulation syndrome. A condition called polycystic ovary syndrome can cause hormonal imbalances that can lead to non-functional ovarian cysts, which can also lead to infertility. And excuse me, I have the burps going on right now. But it can cause infertility, which means that you have a hard time or cannot produce children. Okay, and some of the symptoms, I actually named some. I named mine earlier. I'm just going to name all of them just on my paper. We have some of the symptoms is pelvic pain or pressure, pain in the lower abdomen, pain during sexual intercourse, increasing girth or swelling of the abdomen, which means your stomach area. If your stomach area gets big, super big, that may be a symptom. Abnormal menstrual cycles, increasing pain with menstrual cycles, which means that you actually cramp a little bit more than your normal. And when you stop having menstrual periods without being pregnant. Now, diagnosis, like I said, I did a CT scan. You can also get an ultrasound or x-ray of your pelvic area in order to diagnose that you actually have a cyst going on so that you can get your treatment. Now, I'm actually going to talk about my surgery a little bit. I have to get a laparoscopy. I know I probably just pushed that word again. But, yeah. So I had to get one of those. And what that basically is when the doctor has to make a small incision, and they actually have to put tools inside those incisions so that they can actually, it's actually controlled by a robot. The robot is controlled by your doctor or the nurse. So what they do is they basically go in, they move the robot around to try to, first of all, find the problem. Once they find the problem, they're actually going to extract the cyst out. And they're going to research it, actually. So that means I'm going to be a research person. So they're going to research it to see exactly why I had this cyst, see how serious it is, what do I need to do to follow up, and all of this stuff. And let's see what other papers I have. These are actually my papers for my medicines, my pain medications that I had to take. Okay, so we're going to talk a little bit about treatment. As you know, like I just mentioned, I actually have to have a surgery, a diagnostic surgery, so I can see what's going on, what caused the cyst, and what I can do to prevent it. Okay, so many of them go away on their own, like we said earlier. And your health provider might want to check your cyst regularly for 2 to 3 months to see if it changes. For women in menopause, it is particularly important to monitor cysts closely because of the higher rate of ovarian cancer in menopausal women. When treatment is needed, it may include any of the following: a procedure to drain the cyst, which is aspiration. This may be done by using a long needle in ultrasound. It can also be done through a laparoscopic procedure. This involves using a thin lighted tube with a tiny camera on the end, which is a laparoscope, that is inserted through a small incision, which is what I'm going to get done. Surgery to remove the whole cyst. This may be done using laparoscopic surgery or open surgery involving a larger incision in the lower abdomen. And also, you can use hormone treatment or birth control pills. And these methods are sometimes used to dissolve a cyst and make it go away. So, some instructions once I get home and stuff. Wait, no, this is actually after they diagnosed me with the cyst. Take over-the-counter prescription medicine as directed, by your healthcare provider. Follow up with your healthcare provider and get regular pelvic exams and pap tests. What is a pap test, you ask? A pap test is basically a pap smear when they use the the speculum is a clear speculum, or if you go to one of those other doctors or something that use the metal one, I imagine probably hurts a whole lot worse than the plastic one, but however, they stick a clear speculum inside of your vagina. They open your vagina up and they actually swab you and test you so that they can make sure that you don't have any STDs, or in my case, make sure that you don't have any ovarian cysts. Okay, so let's see what else. Okay, that's basically all of the informational stuff I have. So now I'm gonna just tell you a little bit about what I've been doing today in my prep for my surgery. So I'm gonna go and get my paper and I'll be back. Okay, so I'm back and I have my paper on my prep for the day before surgery. Now it is now 7:07 p.m. Just turned 7:07 on my clock. Um, and I'm just gonna tell you about my instructions the day before surgery, which is today. And first of all, it is called the same day surgery, and I have to arrive at 5 a.m. in the morning. I am not that much of a morning person, but you know what? This is about my health, so I need to do what I need to do. So I'm gonna be up before 5, well before 5, and I had to be there at 5 o'clock in the morning. Now, this morning I actually had to eat a good breakfast. What in the doozy is a good breakfast? I just ate what I normally eat, which was just a little bit. I actually cut my servings of bacon in half, and I ate one egg and some toast. I actually went without my cheese. I'm a cheese fanatic. I went without my cheese, so that's progress. And for lunch, I said eating moderate lunch around 12 noon, but no beef. So it means I haven't really been eating. I haven't eaten any meat since this morning, actually. And I had my breakfast before 7:30. I think I finished eating around 7:15 ish. I started eating at 7, but then I was eating slow. Okay, and it says no solid food after lunch, but you will be allowed to drink liquids, jello with no fruits, and soup broth. And you will be allowed to eat one small salad. Now, what I did, I actually have a picture that I'm going to be posting. And what I actually did was I just ate some lettuce and some dressing. No croutons, no chicken, no ham, no cheese. But yeah, so I ate lettuce and dressing. And it was actually the vinaigrette dressing. And this was actually between 4 to 5, p.m. No milk products. I'm a milky. I love milk food. I love cheese. I love milk. Anything that has milk in it, I love ranch dressing. Milk girl. But can't have any milk products after lunch. No apple juice, no prune juice. Prune juice is probably nasty anyway. It looks nasty. Never had any. Okay, so prior to the surgery, I had to purchase two 10-ounce bottles of magnesium citrate. And let me tell you, that mess is ugh. But it does what it's supposed to. It's supposed to clean you out so that the doctor basically can have a clean stomach to work with, clean abdominal area, so that he don't have to worry about any bowels coming out of you while he's actually in there, he or she. And yeah, because you don't want any bowels coming out, leaking out on the doctor. That's just be so disgusting. And if you don't know what bowel is basically defecation, doo doo, boo boo, whatever you want to call it. You don't want that. So we had to clean out our system. I've had my 2 bottles of magnesium citrate, and I drank one bottle between 2 to 2:15 p.m. Another one between 6 to 6:15 p.m. And this was actually a little bit earlier. Okay, and after midnight, the evening prior to surgery, you may not eat or drink anything. It's going to be hard for me. So I think what I'm going to try to do is probably try to stay up a little bit and just take a nap in between the restroom breaks in the stomach. I don't know if you heard, it just made a real sound, a real big sound, which means that I probably have to get off the camera pretty soon. I'm sorry if it's TMI, but I'm just being real here. So I'll probably be off the camera in a little bit. Let me just try to wrap up this video. So after midnight, prior to surgery, you may not eat or drink anything. So I'm gonna just do my bathroom, restroom. I'm at home. This is a bathroom. Got a bath in it. So bathroom, nap in between, and then I'm just drink some water. I'm trying to drink some water every hour so that I won't be as hungry. So that should help. And I'm gonna stop drinking water at 11:55 p.m. and go to bed. Cause if you've been up late, you know that when you're up, you're gonna be thinking about food. If you sleep, you're not gonna be thinking about you being hungry. You're gonna be sleeping. Okay. So, okay, and this anything that I just mentioned earlier, anything. This includes medication of any kind, no gum, nothing. Nothing. Okay. So if you do have any medication, which I don't, but I'm just gonna bring my pain meds from when I had the initial symptoms going on. I'm just gonna bring my pain meds along with me. So bring your medications to the hospital, and the anesthesiologist will administer it at the appropriate time. This is very important because if you have something in your stomach, you're not about to have surgery. Because that doctor don't want to deal with your bowels coming out. Don't nobody want to deal with that boo-boo. But yeah, so if there's something in your stomach, no anesthesia. No anesthesia means no surgery. And if you're a smoker, no smoking 5 days prior to the surgery. And please be prompt, because if you're not prompt, it's going to delay. You're going to be sitting there all day. You're going to be hungry. So that's what I'm going to be there at 4:30. 4:30 in the morning. You don't want to be sitting there hungry, because you didn't come up there on time. I'm going to be there on time. So be prompt, which means be on time. And if you have any questions, call your doctor. So what I've done so far is I've eaten my breakfast, lunch, dinner. So now I'm just on an all liquid diet. Water. So, yeah, and my stomach is making a noise again. So I'm going to post this video, and I am actually going to be back after the surgery. Well, I'm going to come back tomorrow on the way to the surgery room. Well, not to the surgery room, but while I'm at the hospital getting admitted and all that, and just let you know how I'm feeling so that you can actually see, like, if you have any of these things going on, so that you'll be able to know what to expect. So I'm actually going to be gone for the day, the rest of the day, and I'll be back tomorrow to let you know what's going on with me. So if you haven't already, subscribe, like my video, comment, let me know if you've gone through this before and you've experienced something different. Let me know. If you have to go through this, just let me know. Ask any questions. I am constantly on YouTube. And even when I go back to work, because I'm actually a teacher, even when I go back to work, in between, I'm going to be looking on my YouTube, trying to see what's going on. Because I want to help somebody. I want to help you as much as I can. So feel free to comment, subscribe, like, share if need be. I just want to help you. So I am off to one of my second homes for the night. So I will see you back in the morning. Ugh. Yeah. See you later.